Welcome back, everybody. For nearly 300,000 children in the United States, ordinary moments such as running, playing, riding, and just being a kid can turn into some pretty big obstacles because of pain caused by rheumatic diseases, things like juvenile arthritis. But this weekend, the Arthritis Foundation is hoping to raise some awareness and some crucial funding for research and treatments for this condition with its annual Jingle Bell Run.
Ahead of that event this Saturday, we would like to bring in an expert now to explain more about how juvenile arthritis affects kids out there. Dr. Sharanya Joginpalli is a pediatric rheumatologist with Child Neurology and Consultants here in Austin. Dr. Joginpalli, thanks so much for being with us. We appreciate you being here.
Thank you for having me.
So I think it'd be best to start for people out there to help understand what juvenile arthritis is exactly. How is that different than, say, a growing pain for a kid out there?
Sure, that's a really good question. So juvenile arthritis is a chronic inflammatory disease of the joints. So it affects children under the age of 16 years, and it's characterized by chronic joint symptoms that cause a lot of pain and inflammation in the joint. It's a little bit different than growing pains that does not cause inflammation, and it's usually present in younger kids.
So what should parents be on the lookout for? I mean, are there any early signs or symptoms? How is this affecting kids on a day-to-day basis?
Yeah, so JIA, otherwise known as juvenile idiopathic arthritis, it can present with pain as the most common symptom, followed by swelling, persistent swelling in the joints, morning stiffness or stiffness after periods of rest, limitation in activity, not wanting to play. Parents' biggest clue is usually a child doesn't want to do their usual activities, or kids drop out of sports and have difficulty walking around in school.
Okay, definitely some things to keep in watch for out there, but are there any advancements in treatment or research to help deal with this?
There are a lot of new treatment options and ongoing research trials in our realm of pediatric rheumatology. I will say the newer research trials we focus on is how to get patients into faster remission, meaning they have absence of clinical symptoms. There are a lot more approved medications now than we had decades back, so we've made a lot of advances.
What kind of hope does that give you as a provider treating some of these kids to know that in the future there is some hope for them, some way forward?
Yeah, it's a confidence booster, I would say, practicing this every day. As soon as I diagnose and treat a kid, I would say early recognition of symptoms and awareness of the disease is most important. And then once we start treatment, just knowing that these treatment options are there that can work faster and keep them healthier in the long run to lead better quality lives, I think is the take-home message of the treatment for arthritis.
So this weekend we want to highlight the event that's going to happen. It's the Jingle Bell Run. It's going to support research and some of those advancements that you spoke of. So why is this run so important to continue to have here?
I think that it is a great, family fun holiday activity that the Arthritis Foundation has every year, and almost in every city. We're happy to host it here in Austin this year, and it just brings, I think, our arthritis community together. There's patients and families and volunteers all in the Arthritis Foundation that can show up and basically spread awareness of what juvenile arthritis is, how many kids are affected, and raise funds for clinical trials, research grants, all to better the improvement of our kids with arthritis.
And what can people expect if they come out to the event? I know that they'll be able to interact with some of the people who are dealing with this, but what else can they expect out there?
Yeah, so there's lots of other practices, other providers in the rheumatology fields. There are representatives from other healthcare fields and also pharmaceutical companies. So it's really, I think it's an eye-opener for families who either don't have kids with arthritis or are looking for resources for their child with arthritis, just to know what's out there, who all can help treat it, who all can they connect with, peer support groups, family support groups. So it's a really great resource for them to be out there with us.
Such a great event that folks can actually meet those people face to face and meet providers like you.
Yeah.
So we want to show on the screen here, we have some information about the Jingle Bell Run. It will be at Lakeline Park, the Grand Pavilion up in Cedar Park, and registration will start at 8. We know that that run starts at 9 as well, and we've got more information on that screen there too for you to take down if you're interested in coming out, doing the run, but also just getting some great FaceTime with experts like yourself. Doctor, thank you so much for your insight. We know a lot of families are going to be grateful for this.
Thank you so much.